As if coronavirus and monkeypox weren't enough, New York State health officials are urging unvaccinated children and adults to get inoculated against polio as soon as possible. The virus has been found in 7 different wastewater samples in 2 counties north of New York City. One expert told CBS News,
"Polio is extremely infectious. It's very good about transmitting. And so by looking for it in the wastewater system, into the sewers, we can actually see whether or not there's a detection, not just in one particular household, but within a community."
Only one person has tested positive for polio so far, an unvaccinated young adult in Rockland County who developed paralysis. This is the first case in the U.S. in nearly a decade. State officials believe it may just be the tip of the iceberg, and that there may be hundreds of people who have been infected but have no symptoms yet. Back in 2018, Rockland County was at the heart of the 2-year measles outbreak. The polio vaccination rate for 2-year-olds is 60.5%, compared to the New York State average of 79.1%, according to the New York State Department of Health.
The take-home message is still very reassuring. Vaccines work, and they work very, very well. But if we have less and less coverage of the vaccines within our community or within our nation, we're going to see more and more of these types of infections.
State health officials and the CDC confirmed the virus originated from the live oral polio vaccine used in other countries. That vaccine is no longer given in the U.S. Most people infected with polio can be asymptomatic but can still shed the virus and pass it along to the unvaccinated for days or even weeks. A small percentage of people who get polio suffer paralysis or death. For Inside Edition Digital, I'm Stephanie Officer.